That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other.
Hey, everybody. Welcome back to another episode of the Real Health Podcast with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor, and Brandi is the boss and the face and the genius behind all of this, the color commentary and all of that. She's the star, and I bring you articles. We read these articles, which is information in the news, mainstream media, and anything related to health and wellness. We read it for you. We summarize it. We tell you what it means. We tell you how to apply it to your life. We give you the wellness perspective, natural perspective behind it. And our focus and goal is, as always, to make sure we can help you feel better, get stronger, live longer, and feel younger.
Yep.
How's your day today?
I'm a little less itchy today. I'm very excited about that. I had a very wonderful exposure to poison ivy or poison oak a week and a half ago and had a bit of an allergic reaction to it. So other than that, I'm doing great today.
Okay.
How about you?
Yeah. Well, I'm wearing my glasses,
I see that.
my new glasses.
Yeah. You seem pretty good.
I see good. Yeah, I see well. You know, my prescription hasn't changed in a few years.
Yeah. You willed your eyes to get better.
You
Or stay
remember
the
that?
same.
Yeah.
I do.
Yeah. So when was it? Probably 4 years ago.
Yeah.
So I saw this art. There was news about, or it wasn't news. It was a story that some motivational speaker was telling about a doctor whose patients were getting better faster than all the other doctors, and then the other doctors were referring patients to him. Now, sorry, I don't have the name of this doctor, but it's an absolute true story because I looked it up, and the only difference was this doctor who was getting results with patients that everybody else failed to help was because he would make the patient say this one phrase over and over, and he would say, unless you say this at least twice a day, every day while I'm working with you, I'm not going to accept you as a patient. And the phrase was, every day in every way, I'm getting better and better.
Yeah. You know, I think what that really relates to, because some people go, okay, it's just a nice thing to say, or you're just trying to motivate yourself. But there is a very well-known mind-body connection.
Oh, yeah,
right?
absolutely.
And I mean, we know that there are studies where athletes just sit in a chair and visualize their workout or whatnot, and having electrodes attached to their muscles, they can see firing patterns in muscles when they're just visualizing, right? So
Right.
that's pretty cool. Excuse me. So I think it's really the same thing, right?
Yeah.
It's going, I'm going to
Right.
focus my mental energy on this part of my body.
Yeah.
I mean, that's what bodybuilders do. That's
Right.
one of the biggest things that gets them the best results is that mind-body connection to the muscle.
Absolutely. Yeah. So I did that for a year.
Yeah.
I said something a little different. I said, every day in every way, I'm getting healthier, younger, and stronger.
Yep.
And so a year later, I go in for an eye exam, and the eye doctor said, your prescription's actually improved instead of declined.
Which is rare.
And yeah, so she said, your contact lenses are too strong for your eyes.
That's so funny.
We need to tone them down a little bit. And that, you think that's a miracle, because every year until then, my eyes kept getting worse.
Yep.
Every time I went in, and then they haven't changed. It got better that year.
Yeah.
And it stayed pretty much the same
And what
since
I like about that too is shortly after, your prescription had gotten better, we had taken our middle Ramin for an eye exam.
Yeah.
And that doctor was saying, oh, they're getting so bad, you're going to need to get a special. I'm like, whoa. We don't need all that. Like, don't put that in his head.
That's right.
How about let's just tell our body not to do it? Now, if your eyesight still gets a little worse, you're in no worse a shape. But I know what we worry about or what we fear, our body follows. Like our physiology follows that.
Yeah.
So I think it's really important.
I mean, how many patients do we have whose doctors told them they would never walk again? And they're
So many.
doing everything. You look at them, they don't look like they're missing anything.
No, I mean, your aunt is a prime example of that. She was never going to work again. She wasn't going to be able to walk without a walker or possibly be in a wheelchair because she broke her back. But through going through her, her therapy and being adjusted regularly, she does not even seem her age.
Yeah.
So I really think that that's something that we need to keep in mind. That mind-body connection is huge.
Absolutely. So let's jump in.
I know. I'm kind of excited talking about that.
So this first article is from the New York Times. The title is "When is the best time to work out?" Did you work out today?
I haven't yet.
I worked out today, and I got a story about that too.
Well, I have a story too, because
Yeah?
I'm interested to go through this. I did ask my coach. I have a new coach as well. Her name is Jane. She's amazing. And we're doing really well.
Does she watch our show?
I don't know. Hopefully she will now. I told her I was going to give her a shout out, but I asked her, when do you think is the best time to work out? When do you get the most results? So I'll be excited to share,
Okay, yeah,
what
good.
she thought too.
All right, because these people have no idea. I mean, the article, I don't even know why they write articles like this. They give you a title, they give you a question, you read the article, they don't answer it.
Yeah. Well, that's not uncommon.
So it says, it's a straightforward question with a frustrating number of answers based on research results that can be downright contradictory. The latest piece of evidence came last month from a group of Australian researchers who argued that evening was the healthiest time to break a sweat, at least for those who are overweight. Their study looked at 30,000 middle-aged people with obesity and found that evening exercises were 28% less likely. Evening exercisers were 28% less likely to die of any cause than those who worked out in the morning or afternoon.
That's an interesting thing to pull.
An exercise physiologist at University of Sydney led the study, said, we didn't think the risk reduction would be as pronounced as it was. 28% is pretty big.
It is.
Like out of 100 people who work out in the morning, 28 of them might die, but if they worked out in the evening, they wouldn't die. Is that kind of
That's
28%?
what they're saying.
Or 28%? 28 more people out of 100 would die. Everyone's going to die. I hope
Correct.
that's not a surprise. But because it doesn't say early death, does it? Likely to
No.
die of any cause. I mean, does that include old age?
It's such a.
This is terrible. It's
I
a
mean,
bad article.
I don't even think the
New York
research.
Times, fix it.
I don't think the research study was adequate either. I mean,
you get a grant, you have to spend the money.
I guess so.
It says no single study can dictate when you should exercise. For many people, the choice comes down to fitness goals, work schedules, and plain old preferences. That said, certain times of day may offer slight advantages depending on what you hope to achieve. Mm-hmm. So here's the case for morning exercise. According to a 2022 study, morning exercise may be especially beneficial for heart health. It may also lead to better sleep. Last year, a study published in the journal Obesity found that people who exercised between the hours of 7 a.m. and 9 a.m. had a lower body mass index than counterparts who exercised in the afternoon or at night. Though it did not track them over time, unlike the Australian study, which followed participants for an average of 8 years. So those 28% that were less likely to die, we're going to die 8 years after? Is that what we can extrapolate? The biggest argument for morning exercise may be purely practical. Yeah, I like exercising in the morning myself.
Right.
So the case for afternoon exercise, and it says this is more for elite athletes. Body temperature, which is lower in the morning but peaks in the afternoon, plays a role in athletic performance. Several recent small studies with competitive athletes suggest that lower body temperature reduces performance, though warm-up exercises help counter that. Mm-hmm. And afternoon workouts help them play better and sleep longer. If you have the luxury of ample time, one small New Zealand study found that it can help to nap first.
Nice.
Before the workout. As far as the rest of us are concerned, a Chinese study of 92,000 people found that the best time to exercise for your heart was between 11 a.m. and 5 p.m. So that's for afternoon. Then there's evening. The latest study may not settle the debate, but it certainly suggests that those struggling with obesity might benefit from a later workout. Exercise makes insulin more effective at lowering blood sugar levels, which in turn fends off weight gain and type 2 diabetes, a common devastating consequence of obesity. In the evening, you are most insulin resistant. Dr. Sabag said. So, if you can compensate for that natural change in insulin sensitivity by doing exercise, he explained, you can lower your blood glucose levels and thus help keep diabetes and cardiovascular disease at bay. 1%. You know what bothers me is cardiovascular exercise doesn't increase insulin sensitivity. Weight training does. So they're not telling you what kind of exercise.
Correct. They're looping it all together.
Why aren't they separating it between weight training and cardio? It's two separate things. And
Very different.
High intensity cardio, low intensity steady state cardio, interval training. You've got so many.
Yeah, and they all affect the body vastly differently.
Absolutely. One persistent concern about evening exercise is that vigorous activity can disturb sleep. However, some experts have argued that these concerns have been overstated. Well, listen, cortisol is supposed to be high in the morning and low in the evening.
Correct.
But when you exercise rigorously or vigorously, whichever one it was, you increase cortisol.
Right.
Which means your quality of sleep is not going to be good. Now, he's saying these things have been overstated. I don't believe that's the case. I don't think you should work out too late in the evening. Personal opinion. The case that it may not matter. I like this one. While many of these studies are fascinating, none of them is definitive. For one thing, most are simply showing a correlation between exercise times and health benefits, not identifying them as the cause. Well, there you go. Arnold Schwarzenegger, the bodybuilder, actor, former governor, cited a 2023 study suggesting that there really isn't any difference in outcomes based on which time of day you exercise. And he said, I will continue to train in the morning. It's automatic for me. And I think I will do the same. So I really dislike that study, but I thought it was a good thing to prime some conversation with our audience because I think it's something everybody wonders. Now, when it comes to weight training, I've seen other studies, and I don't have the citation right now, that says you are strongest between 10 a.m. and 2 p.m.
Well, let me tell you what Jane said. So this is from my bodybuilding coach. She's a professional. She has her pro card. She's been competing. She's amazing. She said it all depends for everyone. She said, I feel like mid-morning to afternoon, you will have more performance and energy after about 1 to 2 meals. And then after your workout, you'll have about 2 to 4 meals left for the day to have for you to really recover and grow throughout the day. So if we're speaking about muscle growth and performance, she feels like getting a few meals in under your belt before you go work out and then having a few meals to be able to feed the body is ideal if we're talking about performance and muscle growth.
Makes sense.
Makes sense to me too. So I thought that was a really great recommendation.
What about fat loss? Did she talk about that?
I didn't ask her about that.
My coach said, because I specifically asked, should you do fasted cardio? And he said the only time fasted cardio is beneficial is if you're on a supplement that reduces blood sugar.
Okay. Interesting.
So I don't know what that meant. I'll have to clarify that with him. Speaking of muscles, next article is also from the New York Times. I think this one is just as bad as the other one. It says, muscles in knots, ? Here's how to loosen them up. So again, I like this because it gets us to talk about it with our audience. I know a lot of people have muscle knots, and most people don't even know what a muscle knot is. So it says, if you've ever had a shoulder massage or used a foam roller, you have probably found a few small painful bumps deep in a muscle. Once you're aware of these bulges, called myofascial trigger points or muscle knots, they can be tough to ignore. So what causes the muscle knots? Muscle knots tend to form when a muscle is overloaded, either through exercise or poor posture. They are most commonly found in neck, upper trapezius, upper shoulder muscles, as well as mid-back, forearms, and calves. And also, of course, they say leaning over a computer for hours a day will create those muscle knots. When muscles are overtaxed, they can become damaged, causing certain points to shorten or tighten. They theorize this may lead to decreased blood flow and fluid in the area, as well as inflammation.
Well, there's one thing that they missed completely too, and that is if there's instability in the spine, if there's misalignments in the spine,
Yeah.
if it, that right there alone is going to cause the fascia surrounding the spine to not function the way it's supposed to.
Yeah, so the muscles they mentioned are postural muscles, and so we train when we work out. Everybody who works out, they're focused on only two types of strength, but there's a third type that they ignore, and I make all our patients do this third type.
Okay.
Now, one type of strength is how much weight can I pick up.
Right.
The second one is how many repetitions can I
Your
do.
endurance.
But the third one is once I pick up this weight, how long can I hold it up?
Right.
Your postural muscles hold you up all day. Like they're talking about sitting at a computer.
Right.
Your postural muscles hold you there. The ones that have to contract and stay contracted for an extended period of time, those are the ones that cause
Right.
muscle knots. Now they're talking about overtaxing, over-exercising or whatever. Sometimes when you're exercising, you tense those muscles while you're exercising. So that's what leads to the muscle knots. So it's not the exercise that does it, it's how you're doing it. And
Could be your form. You could be lifting weights that are too heavy and
Right.
losing your good form.
So think about it. They mentioned forearms as a potential for developing muscle knots in. Well, if you're holding a weight, you're squeezing it, you're using your forearms, that doesn't relax during the whole range. Now the bicep, if you're training the bicep, that relaxes at the bottom or at the top. But the forearm is still working.
Correct.
So that's why it's sustained pressure. So you've got to train it differently. We do have really great videos on our YouTube channel. And I'm a big fan of Eric Goodman's work. So Dr. Eric Goodman did some postural things.
They're amazing.
Foundation training. Certainly look him up. We don't get paid for endorsing him. I just like his work. He's a great chiropractor and he said some great things. So his videos are beneficial.
And let me tell you, if you're a person who loves yoga and whatnot, this is one of those exercises, especially that you need to bring into your routine. There's a lot of yoga-like exercises that are in Dr. Goodman's session there, and they are just fantastic for keeping the muscles.
Just search for Eric Goodman Foundation Training.
Or you can go to our website and look at our exercise playlists, and it's listed in there. There's a link there as well.
Template 3, Template 4, and Template 5 all have the Eric Goodman video in there. Now, the other thing it talked about is something about decreased blood flow and fluid in the area, and I think that's different. So maybe it's a simplified version of it, but one thing that happens is, when muscles get tied up in a knot, like a rope that's in a knot, blood can't flow through that knot as well. So they're correct about that. However, what happens is the reason it hurts is because metabolic waste builds up in that area, and that's why it becomes tender. If blood can flow through it, it can wash off that metabolic waste. Some of that metabolic waste is lactic acid. So if muscles contracted, stays contracted long term, it develops knots, and the lactic acid, when you press on it, that's what causes the tender, plus other metabolic waste products.
Now, there are supplements that you can use, right, to help get that waste moved through the body faster, correct?
Sure. I mean, any anti-inflammatory natural supplements. Kava is an herb that in higher doses acts like a muscle relaxant. Now, again, it's because it's an herb, you cannot take it if you're on medication, and you can't combine it with other herbs unless you're being supervised by a doctor. So be very, very careful with anything herbal. But yeah, kava can act like that. Were you thinking about something else?
No, I was thinking there was another supplement that a lot of athletes take to remove lactic acid from the muscles. There's also,
magnesium can relax your muscles. The type of magnesium, we reported on a previous podcast on the 9 different types of magnesium. Magnesium glycinate or bisglycinate seems to work best for people who are athletes who train a lot, lift weights a lot. And I can't remember the other one. It just slipped my mind, but if it comes to me, I'll tell you. But yeah, magnesium can relax the muscle. Scientists aren't entirely sure why some knots hurt and others don't, or why some hurt only when pressed while others ache all the time. Most experts don't think muscle knots cause irreversible damage to your body, but they can impact your ability to move comfortably and contribute to chronic pain. Many knots will go away on their own after a week or two. Well, only if you stop doing the thing that caused it.
Right. Right.
You're telling me if I sit at a computer for 8 hours, I'm going to develop some knots.
Right.
Keep sitting at the computer for 8 hours every day for 2 weeks, it's going to go away?
It's not going to go away on its own, folks.
They talk about heating pads and ice. Studies suggest that both heat and ice can help to reduce muscle knots. I think heat can relax a muscle temporarily, but it doesn't reduce inflammation.
Correct.
Ice,
It actually increases blood flow.
it can, well, when it comes to injured tissue, but these aren't
Yeah.
injured tissue. So I would try both. It seems like upper back tension seems to work better with heat. However, in general, ice is an antispasmodic, so it reduces muscle spasm, and that's why I prefer ice.
But can I give a caveat too?
Please.
Is that sometimes there is an injury that we pass off as just knots or, little spasm or I slept wrong. So don't discount those. Sometimes even our healthiest people that work out a lot still get injuries that they weren't anticipating or expecting. And if you are somebody who has a lot of chronic pain anyway, your pain threshold and what you're able to handle can be much higher than someone else's. And I think sometimes we do ourselves a disservice by just going, oh, it's going to go away. Right. We know in our line of work, those are the 5 most dangerous words you can ever say
100%.
is I thought it would go away. And so there's a part of me that goes, okay, if you've tried to stretch out that fascia and you've tried to work out those knots, it's not going away, or you have a lifestyle that doesn't allow, if you do sit at a desk 8 hours a day every day and you don't have a choice, then you may want to look into something to make sure your structure is good.
Yeah.
Get some x-rays done, make sure your alignment is proper so that you're not adding insult to injury.
That's right.
So
Muscle imbalances also lead to knots. So, for example, everything has an agonist and an antagonist. The antagonist to your bicep muscle is your tricep. The antagonist to your hamstring is your quadricep, and vice versa. And so if one is weak, the other will develop knots. So, for example, your upper traps, the antagonist to the upper traps is the mid and lower traps. Most people's mid and lower traps are weak, so the upper trap becomes overactive because it has to do all the work, and it holds your shoulders up high and develops knots. So seeing someone like a physical therapist or a chiropractor who understands muscle firing patterns and muscle physiology, that person can find those areas of weakness. Like we do the surface electromyogram, we see yellow bars on the graph, which indicate weakness, and then we work on strengthening those. We see asymmetric patterns where one side's tighter or stronger than the other side. We work on balance in the other side. So those are all important. The article talks about stretching. It says it won't eradicate knots either, but it can also help reduce pain. In part by increasing fluid in the surrounding tissue, which allows everything to slide and glide more easily, Dr. DePrado said. Experts recommend stretching either after exercise, when your muscles are warmed up, or before bed. And I actually like stretching before bed. You feel more relaxed. You can sleep better.
Yeah. When I do my yoga at night too, before bed, I feel the same.
Yeah.
It feels really good.
Massage is beneficial. We don't need to get into that. And you all know what massage feels like, pressure.
But there is one thing that people don't know, and that's FST, which is fascial stretching technique.
Yeah.
So if you are a person who is very tight and you're not as great at stretching and you have the funds to be able to hire somebody to stretch you, there are a lot of massage therapists who are familiar with FST, which is the fascial stretching technique, and they will go in and do that active stretching for you, every single joint in the body. Everything gets stretched, which is really fantastic because they can really help to increase your flexibility, your mobility. See where there's any kind of impingements, tightness. So that's one thing that people can look at as well. You get to stay fully clothed. It's great.
Just do a search for FST certified practitioner near me.
Yeah. And if we do have a therapist that we really like, Muscle Menders. He does both massage and stretch, and so he's one to look into. He's in the Frederick area, so that's Muscle Menders.
Absolutely. We go to him ourselves
Yep.
regularly. Dry needling, often performed by a physical therapist or acupuncturist, appears to be among the most effective longer-term treatment for muscle knots. It's called dry because nothing is injected. Experts theorize that the treatment may be effective because it causes a micro injury to the muscle, which prompts a healing response as blood rushes in. Consider wet needling, Dr. Goldman said, or injecting a pain medication such as corticosteroids or numbing agent into the knot. I remember we used to do, the clinic I worked at, we used to do trigger point injections, and it was lidocaine and steroids, anti-inflammatory steroids that they would inject into the center of the muscle knot, and it would make it relax. But dry needling seems to work very, very well, so I don't think you need that. You don't need the chemicals in your body.
Yeah, and the cortisone you have to be cautious of because it does affect like ligaments and tendons and makes them more susceptible to rupture. So we're very cautious about people doing, multiple cortisone shots, especially because there are risks involved.
And then it talks about how some doctors have begun injecting botulism toxin, which is Botox, into the muscles.
Sorry, did I just shake my head? No.
Which may temporarily relieve pain by paralyzing the tissue. But Dr. Gerber cautioned that there isn't much evidence for its long-term effectiveness. Yeah. And anything that says toxin should not be injected in the body.
Botulism, that makes me very nervous to put into my body. I'm just saying.
Yeah.
And then you're like paralyzing something. That just doesn't sound wise.
Right. They do this for migraine headaches too.
I know.
They inject in the back of the skull.
I know.
In the muscles. And, and some people, actually, none of our patients that I know have really benefited too much from that, but they've been getting it regularly. So how do you prevent them from coming back? It says, first, be mindful of your posture at your desk or on your phone, computer screen, or smartphone. Next, be sure to incorporate regular movement breaks into your day. Every 20 minutes or so, stand up, stretch, take a lap around your home or office, or do whatever feels good. Research suggests regular exercise will help too, particularly strength training. I see the gym and fitness really as the cure for these, Dr. Goldman said. The stronger and more flexible your muscles are, the less likely it is that they'll become overtaxed in your day-to-day life. And I'm not sure about that. Now, I don't think you can just strength train and not stretch and avoid muscle knots. That's personal opinion. But there's a book. Have you heard of David Goggins? He wrote a book, I think it's called Can't Hurt Me, or You Can't Hurt Me. And near the end of the book, he talks about it, because he's the guy who does who'll run for 100 miles without rest.
Yeah.
Or he did the Navy SEAL training. He was a Navy SEAL, and he did it on a broken foot.
Yeah.
And he was
nuts.
he's really mentally, did you say nuts?
That's crazy.
Mentally tough.
That's what I mean by nuts, because I don't think I could do that. And I'm pretty tough.
I had a patient yesterday who was wearing a T-shirt that had squirrels, and there were 3 squirrels on a branch, and they all had nuts in their hands, and one of them had dropped one of the nuts, and the underneath the T-shirt it said, "It's all fun and games until somebody loses a nut."
That's a good one. Our children would love that joke.
So anyways, but in the end of that book, David Goggins talks about how he had developed knots so many places in his body that he was in constant pain.
Oh, I can imagine.
He spent 8 hours a day for a month stretching to get rid of it. And then after that, he realized he cannot just train without stretching.
Yeah.
And now he stretches daily because he does such intense activity. You've seen me stretch. I never leave the house without having done some stretches. Every day.
I'm getting better. I'm not nearly as good as you.
Just finally remember that there can be too much of a good thing. Pushing yourself too hard at the gym can actually cause knots. That's true. To avoid this, be sure to stretch your muscles progressively when strength training and gradually ramp up aerobic exercise like running.
And if you don't run and you just walk, that's okay too, because that's just as good on your joints.
I hope that helped you, because the article won't help you, but what we said is going to be helpful. Oh, we got a lot of New York Times stuff. Want to do one more New York Times article?
Yeah.
So it's the title says but how does the worm get in your brain? Robert F. Kennedy Jr.'s disclosure that a doctor apparently found a dead worm in his brain has sparked questions about what brain parasites are, the damage they can cause, and how exactly they get there. And I remember seeing that in the news about RFK Jr.
First, I just want to say the idea of it gives me the EBGBs.
I'll wait till we read more.
Now, I've read it, and I still have the EBGBs.
There are legions of organisms that can affect the brain, said Scott Gardner, a professor of biological sciences at the University of Nebraska-Lincoln, who specializes in parasites. That is one specialty I wouldn't want to be.
Like,
in
I would
addition,
love to have seen him as a kid. Was he out there just playing with worms and bugs nonstop? And
I played with cockroaches when I was little, and
Ew.
yeah. Mm-hmm.
Yuck.
You
You did not tell me that before we.
Yeah, but remember we
married.
were in Iran and that one
know.
fell on me?
Yes, that was devastating.
You want to tell them about that?
So they grow the cockroaches in Iran much larger than what I've even seen in Texas. And let me tell you, in Texas, they're ginormous and they
they're
fly.
like this big.
So it was my first trip to Iran, and we were at his house that he grew up in Sari, which is near the Caspian Sea.
It's a beautiful place.
It's gorgeous. It's kind of like a resort town. And so we're sleeping, and we had just turned the lights out, and all of a sudden, like, you hear something drop and you feel it. And he jumps up out of bed so fast, and then I jump up screaming, and then and it was a ginormous, like, roach.
It was on my back. I don't know how it got there because those things don't jump, but it landed on my back and started walking around. And so I flew out of bed and hit the light switch, and we saw it on the bed.
It was so disgusting.
It wasn't this big, but it maybe half this size. Huge.
Well, let's say it was big enough, though.
Yeah.
Okay,
So-
moving on.
Yep. Moving on.
How do the worms get in the brain?
The damage varies depending on the type of parasite and where it ends up in the brain. Some of them actively invade the tissues and destroy tissues, said Dr. Daniel Pastula, chief of neuroinfectious diseases and global neurology at University of Colorado Medicine. Others cause problems because of the inflammatory reaction that they trigger. So then the article goes through the different kinds. There's tapeworms. Humans are typically exposed to tapeworms through raw, undercooked food or through food contaminated with feces.
This is what dogs get a lot, right? Like
Yeah.
being out at dog parks
Right.
and, coming in contact with other dogs' stuff.
So the doctor's consultant said Mr. Kennedy described symptoms of an infection with larvae from the pork tapeworm. This is why I'm hesitant to eat pork. But I grew up in Iran. It's a Muslim country, and they, it's illegal to eat pork
Right.
there. So
Well, you were spared at least this kind of tapeworm.
there's a type of tapeworm that can infect the brain. When a person accidentally swallows pork tapeworm eggs, the eggs hatch in the intestines, and the larva can travel to other organs, including the brain. There, they form cysts, causing a condition known as cirrhosis. I'm not saying that again.
You did really well.
It can take months or even years for people to show signs of infection. Symptoms vary based on how many cysts develop and where they are. Cysts can form in the eyes, muscles, and spinal cord. Generally, though, people with neurocysticercosis experience headaches and seizures, and they sometimes feel confused, struggle to pay attention, and have issues with balance. The
Hey.
condition can be fatal.
I grew up on a hog farm, so I'm a little bit freaked out right now. I've had a
You
lot
might
of
have
worms.
one of these.
Yeah.
You say some funny stuff.
Well, I do struggle to pay attention, and I often feel confused.
But your balance is good at least. That's all. That's all I care about. Yeah. And
It's really
there-
my memory.
Then
That's
there's
the worst.
amoebas. Another type of parasite that can affect the brain is known as brain-eating amoeba. Extremely rare.
Does not sound better than the tapeworm.
Rare. It's rare, but not like a steak that's rare, but like rare as in can't
Doesn't
find
happen
it.
often.
Potentially fatal swelling of the brain spinal cord. The organisms enter through the nose when people swim in lakes and rivers and then travel to the brain. People have also been infected through using neti pots or other sinus rinses with untreated or non-sterile water.
Okay, so make sure I always use my my little granules of saline to put in my neti pot before I use it, and I use silver, colloidal silver in it to make sure that there's nothing. So make sure you guys are using at least the saline crystals if you're using your neti pot. Now I'm a little nervous for my friends Maria and Dan. We're coming to see you at the lake. Now I'm nervous to swim in the lake.
But don't snort any of the water.
Okay, I'll do my best.
That's basically it. And remember that movie about the monkey? It's the kid that was in the wheelchair.
Mm-mm.
We watched it with the kids. So this kid goes cliff diving, and it's a true story. It's a true story. But this movie's about a monkey. But he goes cliff dive. He's perfectly healthy. He jumps in the water. A few hours later, he starts having these terrible headaches and then seizures. And they get him to the hospital kind of late. By the time they get him there, he's in a coma, and then he's now handicapped. He can't move. He has to be in a wheelchair. Has trouble with a lot of things. So then they get a monkey to help him with his day-to-day, and the whole movie's about the monkey. But I thought it was a good movie.
It was a good movie.
But that's what I'm sure he had an amoeba in his brain.
Whew.
A brain-eating amoeba.
It's very scary.
And there's another one called Toxoplasma gondii. One of the most common parasitic brain infections is toxoplasmosis. Over 40 million, this is, well, I'll just read it. Over 40 million people in the United States may be infected with the parasite. That's a lot. 40 million is more than 10%.
That's huge.
More than 10% of people infected with parasite that causes that infection. According to the Centers for Disease Control and Prevention, it says people can be infected by eating undercooked meat or shellfish that is contaminated, or by drinking contaminated water, or by accidentally swallowing the parasite when they encounter it in cat feces, as when cleaning litter boxes.
Okay. Why would we be encountering that when we were swallowing cat feces? Are we not washing our hands? Are we is that how we're getting rid of it? I don't understand that one.
Is it like when kids eat paint chips?
I don't know. Could be. Okay.
The parasite can cause toxoplasmosis. The parasite that causes toxoplasmosis can linger in humans for years, potentially for someone's entire life. But most people will not develop symptoms. For the most part, our immune system does an amazing job at just handling and dealing with this parasite, allowing us to live our lives without even knowing. But it can make some people feel like they have the flu. People with compromised immune systems are at risk of serious illness and brain damage if infected, and developing fetuses can be severely affected if pregnant women are exposed.
That's why they say for women not to deal with cat litter.
Yeah, if you get pregnant, get rid of your cat. So how do you figure out if you have a parasite? That's probably the most important part of the article, huh? Sometimes a patient's blood can be tested for antibodies that are produced in response to a parasite. In other cases, doctors diagnose infections with an MRI or CT scan. Many are treatable with anti-parasitic drugs, which patients may need to take for weeks. Doctors may also prescribe steroid to help with inflammation. Some patients will undergo surgery to remove cysts. In other parts of the world, they are more common than here in the U.S., thankfully. Once again, I say that we are in the best country in the world. I am a patriot, even if it's for the parasite reason. To lower your risk, especially while traveling internationally, be advised washing hands thoroughly before you eat or prepare food, cooking food properly, ensuring that the water you're drinking is clean.
Or that you're prepping your food in.
There you
Do you
go.
remember being on the cruise ship? Sometimes there would be an outbreak of salmonella because of the water contamination. And
That's right.
I remember getting food poisoning on the ship from salad. Like it was salad.
Wow.
So
It
that
was
had been
the water
washed
they
in.
washed it in. Yeah.
So got to be careful.
There you go. Well, we have a lot to talk about, but we don't have time for it anymore. But there's an article on ADHD, why rates of ADHD have increased. There's another article on why stroke rates have increased. And
Interesting.
both of those we have theories on that could get us canceled.
So we're going to talk about them.
We're going to talk about them, and we're going to risk it. You're going to hear about it. So please tune in next time.
The
We'll
FDA
touch
hasn't
on
shut
those.
us down so far.
And there's some information about Parkinson's and the benefits of exercise when you have Parkinson's. California is trying to ban. You remember we report on an article with teeny boppers who are using skincare. They're using anti-aging skin products that was making them all sick.
Yes.
And so anyways, they tried to pass a law that said that you have to be at least 13 to buy those. So we'll talk about that and how that went, whether the law passed or not. And then something about sunscreen. Summer is coming, and you need to know what kind of sunscreen to use. So we'll be hitting on all of those in the next couple podcasts, and we hope you join us.
Thanks so much. We'll see you next time.
Good show.